I'd like to now turn our attention to our next session, Advancing the Decade of the Kidney Global Leadership in Patient-Centered Policy and Care. In June 2019, AAKP announced its major initiative, the Decade of the Kidney. This marks the time between 2020 and 2030 when kidney patients and their allies across the globe will accelerate greater innovations in disease prevention and treatment. Our goals have been very clear. We fully intend to transform status quo kidney care and its associated high mortality and high costs to patients and society. Our vision is to move forward towards a future that incorporates patient insights, ensures wider care choice, and produces targeted therapies that inhibit and cure kidney diseases. We believe closer collaborations among patients, researchers, and private industry will lead to therapies that prevent organ failure, increase the long-term outcomes of donated organs, and will bring about artificial kidneys. Some have asked where AAKP gained the confidence to declare that this, the decade of the kidney. That answer is easy. Our confidence comes from our legacy of working alongside public leaders whose understanding of people with chronic disease and personal courage to push policies that foster innovation has helped transform health and save lives. 50 years ago, the patient founders of AAKP embraced a similar ambitious goal. Their vision was to provide life-saving kidney dialysis care to every American in kidney failure. They wanted their fellow patients to be healthy enough to get kidney transplants and return to work in their communities. To achieve this mission, AAKP organized patients nationwide. They worked closely with allies in medicine, academia, and industry. And one of our brave founders dialyzed on the floor of the U.S. Congress, an act that led to the 1972 congressional passage of legislation for dialysis coverage. Our patient founders had also enlisted the aid of then-President Nixon's budget director, who strongly recommended the president sign the legislation in 1973. This is how modern dialysis in America was created. Our advocacy inspired patients around the world. That presidential budget director was later promoted to a position where he implemented the dialysis program. You may recognize the name Caspar Weinberger. Before he was President Reagan's defense secretary, he was the 10th secretary of the Department of Health and Human Services, or as it was known then, the Department of Health, Education, and Welfare. In 2018, the Honorable Alex Azar assumed office as the 24th Secretary of Health and Human Services. Secretary Azar shared a vision for transforming outdated kidney care that aligned seamlessly with the long-held interests of patients in the wider kidney stakeholder community. He brought his full expert knowledge of the pharmaceutical industry and past experiences as the Deputy Secretary of HHS to solve problems. Upon assuming office, he immediately brought kidney patients, including AAKP advocates, to his conference room to solicit their views and gather their insights, a practice he maintained throughout his tenure. In just a few short years, Secretary Azar cleared obstacles and launched initiatives that boldly challenged outdated thinking. He clearly led the way for patient-centered kidney medicine throughout new patient models that emphasize early intervention, timely treatments, and greater opportunities for kidney transplants. He promoted innovations, including artificial organs. In July 2019, almost exactly 4 years ago, the Executive Order on Advancing American Kidney Health was issued. This historic document included the patient-centered policies championed and led by Secretary Azar. The executive order signaled a new chapter in American kidney health and inspired patients across the globe to unite and push for similar changes in their own countries. Before his term ended, kidney transplant patients were protected from the loss of transplant and drug coverage by the inclusion of lifetime coverage in the final 2020 budget agreement. This was a 20-year goal of the kidney community and was accomplished under Secretary Azar. It is my great honor on this 5th anniversary of the Global Summit to celebrate the man behind the effort, our 24th Secretary of the U.S. Department of Health and Human Services, the Honorable Alex Azar, with AAKP's inaugural Global Kidney Leadership and Innovation Award. Before we welcome Secretary Azar, I'd like to ask Dr. Raj, as Summit Co-Chair, to say a word on behalf of the George Washington University School of Medicine and Health Sciences.
The 24th Secretary of the U.S. Department of Health and Human Services, Honorable Mr. Alex Azar, led the historic transformation of healthcare system in the United States and the HHS robust response to COVID pandemic. From the beginning, he made it very clear that he is not interested in preserving the status quo in kidney health, but embarked on a daunting mission to craft the Advancing American Kidney Health Initiative with the aspirational goal of better outcome through preventive care and person-centered treatment options. Even the critics acknowledge that the goals of the initiative are laudable and indicate a meaningful change for better health care. I just learned that Secretary Azar's father actually got kidney transplantation. I could see a personal and passionate touch in his commitment to the kidney community. So I, along with the kidney community, applaud our Honorable Health Secretary, Alex Azar.
Thank you, Dr. Raj. Secretary. So I'll take a moment. This award is presented for the courage to transform the global narrative of kidney disease and status quo care through principled policy, innovation, care choice, and patient-centered medicine. Secretary Azar, thank you very much. Congratulations, Secretary Azar. We'd be honored to have you share some remarks.
Congratulations. Well, thank you very much, Ed and Dr. Raj, for this deeply meaningful award. I'm greatly honored to receive the inaugural Global Kidney Leadership and Innovation Award in Kidney Medicine at the 5th Annual Global Summit on Kidney Disease Innovations. Ed, I'd like to thank you for your past service to America as a public servant on Capitol Hill, in 2 presidential administrations, and as a U.S. Marine. I've got tremendous respect for the work that you and AAKP are doing to aid military service members and veterans with kidney disease and their families through AAKP's close collaboration with the Department of Defense and the Department of Veterans Affairs. Dr. Raj, I know that both you and Dean Barbara Bass are deeply committed to applied research and patient-centered medicine and are making significant advancements in the field of kidney medicine and related illnesses here at George Washington University. I believe the vision that you and AAKP's former president, Paul Conway, bring as co-chairs of the Global Summit has been critical to raising international attention to the burdens of kidney disease and the need for greater patient care choice and preventive therapies and treatments. Equally important, this summit has brought a tremendous spotlight to the valiant efforts that medical professionals, researchers, and private sector industries are engaged in to bring new kidney care innovations to global customer markets. Over 840 million people suffer from kidney disease and kidney failure across the globe. Here in the US, over 37 million people suffer from kidney disease. Over 700,000 live with kidney failure. and nearly 100,000 people await a kidney transplant. Clearly, the need for regulatory and payment policies that encourage medical innovations has never been greater. When I was first notified of the decision to grant me this important recognition, I had several immediate reflections. The first was very personal. As Dr. Raj mentioned, for those who may not be aware, my father experienced kidney failure. And I was able to witness the entire continuum of kidney disease and kidney care in America, from diagnosis to center-based dialysis, to home peritoneal dialysis, to paired donor exchange transplant, to hospital dialysis, and eventually to death while on dialysis in the hospital. For the patients and caregivers listening and watching us today from across the globe, I want you to know that I truly understand the burdens that you manage and the journey that you are on. I think each of you has great courage and determination to face this disease and to continue the pursuit of your dreams and aspirations. Your disease does not define who you are, and it should never be used to either control or limit what you attempt to achieve as individuals. My second reflection was on the many discussions and meetings that I've conducted over the years within the kidney community. I thought of the many accomplishments the kidney community has achieved over the past several years, just as Ed Hickey recounted in his generous introduction. I consider myself fortunate to have contributed to these victories for kidney patients and kidney medicines. In my professional roles, I've met a wide variety of experts here in America and overseas in specialty medical fields related to kidney disease. They included nephrologists, transplant surgeons, cardiologists, endocrinologists, as well as nurses, techs, and social workers who spend most of their time caring directly for kidney patients. I've consulted with dozens of leaders from transplant centers, private and nonprofit dialysis providers, as well as entrepreneurs and executives leading research and innovation in fields of kidney diagnostics, devices, and drugs. And of course, as the Secretary of Health and Human Services, I led the many federal agencies responsible for researching kidney disease and treatments, paying for the complications of kidney disease, paying for and regulating the kidney transplantation system, and incentivizing and developing new kidney products and bringing them quickly to market and getting them reimbursed by Medicare and Medicaid. It is not an overstatement to say that I have had access to and continue to work closely with some of the most knowledgeable kidney disease experts in the world. Yet among all these experts, there is one group whose knowledge, sense of urgency, and clarity about the burdens of kidney disease rise above all others. Who are these experts? They are the patients I've had the privilege to meet and learn from directly. Among them were the patient advocacy leaders I welcomed around my conference table as my team and I led the development of the most significant changes to kidney care in the United States in 50 years. Their insights were indispensable to the creation of common sense solutions, including the 2019 Executive Order on Advancing American Kidney Health. I'm proud to say the patient leaders of AAKP were regular contributors to those discussions. Patients provided me with a broad and detailed picture of how the consequences of this deadly disease have been managed, or in many cases ignored, for decades. They were candid in their observations that far too many patients, especially people from historically underserved minority communities, were diagnosed with kidney disease in the emergency room amid medical crisis and failure, or as we say, crashing into dialysis. This, to me, was a tragedy with massive implications for people, families, and our national healthcare system. I listened closely as patients described how too few of their fellow patients were informed of their care choices of home dialysis or a kidney transplant. Instead, many patients were presumptively routed to in-center dialysis and were never informed how this could negatively impact their capacity to keep working and caring for their families, and might instead force unplanned dependency on limited disability income. My father was a leading surgeon in the United States, yet it took over a year for us to learn of the option of peritoneal dialysis that so improved his quality of life. Transplant patients, including AAKP's past president Richard Knight, told me stories of how the 36-month limit on federal transplant drug coverage was creating havoc for patients that experienced a subsequent job loss or insurance disruption. before our 2020 establishment of lifetime immunosuppressive transplant drug coverage, a temporary job loss or insurance disruption often forced transplant patients to choose between daily living expenses and the cost of continuing their transplant drugs. This meant some transplant patients needlessly lost their transplant kidneys and returned to dialysis, the transplant waiting list, or experienced premature death. And I listened to patients who had spent years on dialysis and the organ transplant list, asking why, in the face of high mortality rates, innovations like artificial wearable, implantable, or regenerative kidneys had yet to appear as a life-saving care option. So we drove forward the Kidney X program to incentivize innovation in kidney care. These patients understood that kidney disease was not simply a medical issue. They saw it as both an economic and workforce issue. For many, their lives were a testament to the fact that kidney disease denies people the opportunity to pursue part-time or full-time work, the ability to care for their families, and the chance to build a secure retirement. Patient insights, coupled with those of medical experts and other kidney stakeholders, fueled our efforts at HHS to change the narrative of kidney disease and to enact policy changes necessary to transcend status quo kidney care and begin a new era of patient-centered medicine. The result was a complete transformation in how we think about and pay for kidney disease management. Earlier disease detection, faster interventions, improved dialysis technologies, greater opportunities for organ transplantation and new transplant drugs, and artificial and regenerative organs are now the future of kidney medicine. These changes will result in the reduction of patient burdens, unacceptably high mortality rates, and unnecessary and wasteful spending associated with episodic and crisis kidney care. We're already seeing results from the change we made from fee-for-service reimbursement of center-based dialysis to value-based payments in Medicare that reward the type of patient-centered care we all desire. The electronic medical record company Epic reports that as a result of the advancing American Kidney Health Order, we are already seeing earlier diagnosis of kidney disease, which should enable prevention of disease and help reduce the rate at which patients crash into dialysis. We changed the payment structures to incentivize early detection, prevention, and treatment of chronic kidney disease. We incentivized home dialysis options. We incentivized transplantation, improved the rules for living donors, and we changed the rules to make organ procurement organizations more accountable and to improve their performance for patients. The best way to create sound policy and to improve kidney care here in the U.S. and around the globe is to work directly with the stakeholders most impacted by disease. This means patients and not simply health systems or providers. It's vitally important for public officials, either appointed or elected, to listen closely to patients because government works for the people, not the other way around. The accomplishments we achieved would not have been possible without the consistent and robust support of patients and patient advocacy organizations. In 2019, AAKP launched the Decade of the Kidney and the Global Summit in order to expand international support among kidney patients and other stakeholders for increased kidney research and innovation. The lesson is clear. The organized voice of kidney patients can change status quo medicine and is key to advancing the next generation of kidney care treatments and cures. I strongly encourage industry to lean forward and work with patients as partners as new devices and therapies are developed. But because in the field of policy there are no permanent victories, only permanent battles, and because policies often change as national leaders and priorities change, kidney patients and their allies must remain fully engaged in the public and policy arenas. You must remain vigilant to preserve the changes in kidney policy and practice that we achieved, and you must hold your elected leaders and governments accountable if you believe they waver in their commitment to advancing the best interests of patients. Once again, I'd like to thank AAKP and the George Washington School of Medicine for this award and for inviting me to your 5th annual Global Summit on Kidney Disease Innovations. It's been a great honor to appear before you today. Your work is critical to the lives of patients across the globe. Thank you.
Thank you again, Secretary Azar. I'd like to now ask you to turn your attention to the screen and welcome Anita Galić, founder and executive director of Health Hub think tank, as she joins us from Croatia and shares her country's adoption of the Decade of the Kidney.
Hi, Ed. Thank you for inviting me, and it is really a pleasure to be here with all of you at the Global Summit, and greetings from sunny Croatia. My actually role today is to showcase you the example of Croatia during the World Kidney Day and how we manage actually to promote the Decade of the Kidney. I'd like to tell you the Croatian story, how we managed to engage all the stakeholders. First of all, the Health Hub is actually a newly established think tank in this region, aiming to gather all the stakeholders, and the concept of Health Hub is actually quite unknown still in this region of Balkan countries. So it was, I would say, real motivation to engage the stakeholders on the occasion of World Kidney Day and to promote the policies, amazing publications that were actually made dedicated to the benefit of kidney patients. There's one favorite quote of mine that says that the electric light actually did not came from continuous improvement of candles. This is quite known. But many times we're doing the same way from year to year. We did actually, I would say, celebrated the World Kidney Day, but most of the times the patients were actually, I would say, not quite introduced with all the potential that global policies and global activities from associations similar to AAKP or European Kidney Health Alliance actually are doing. And this was something that motivated us as a Health Hub to gather all the stakeholders on this unique occasion. So when we are going fast through those several slides just to see what is the actual motivation behind the Health Hub, our vision is definitely to connect all the, I would say, partners relevant for shaping the policies, for promoting best practices all around the globe. We can go to the next slide to see that one of the, I would say, mission of Health Hub is also to discover the new horizons. And definitely the Decade of Kidney was one of the examples how we decided to discover something new for our policy stakeholders. On the next slide, you can also see that we definitely want to bring the highlight and emphasize the huge contribution of innovations, whether we speak about the digital solutions, digital tools, or whether we are speaking about innovations in policy. So this is definitely one of our core, I would say, pillars that we are working every project in Croatia and in the region. On the next slide, you can also see that while we are working on some initiative like kidney health, like an example for today, we are really want to bring the bold steps. So not only to promote this special day, but we want to have a determined step towards the improvement of policies. And our white paper that we prepared at the end of, I would say, this special period was something that needs to be, I would say, a firm step, bold step towards better policies and better treatment outcomes for our patients. And on the next slide, of course, you can see that we wanted to strongly advocate for European health policies for the benefit of the patients related to the kidney health. We definitely wanted to put a highlight on the activities of the European Parliament, on the Commission's recommendation, Commission's publications for the chronic kidney disease. Then on the next slide, you can see definitely that our think tank platform primarily launched for connecting all the stakeholders. So this is something that it isn't only a quote, but at the end of this presentation, hopefully you will see that even this participation, which we are very proud of at the Global Summit, is something by which we are working on bridging the gaps between the communication with different stakeholders. You can see that we are really want to work on the appealing, I would say, content of our policies, of our recommendations, of our patients, of our professional societies, even administration. So we really want to put the flag on everything that we're doing, that it becomes really visible, because most of the times policies can be quite, I would say, conservative. So our campaign and initiative needed to be something that is appealing and visible also for the media, for the overall, I would say, healthcare ecosystem. You can see that there is one saying, if you don't have a seat at the table, you're probably on the menu. And this was something that was a motivation behind our campaign on the occasion of World Kidney Day, because many participants of the ecosystem, patients, approached to us saying that there is a lack, I would say, of international policies here. How can we, as a think tank, help to make kidney disease more visible on the political arena, because oncology is strongly promoted. It is a European political priority. Immunization is also political priority. Some kidney disease was somewhere at the periphery of the policy. So that was the motivation, that we wanted to gather all available informations, initiatives to go forward with our campaign. So that is the, I would say, core motivation. On the next slide, you can see that we wanted actually throughout our research to disseminate the Decade of the Kidney as an amazing initiative that our research team really recognized as a huge potential, I would say, so quality shaped a platform that really can join all the stakeholders dedicated to a mission of better treatment outcomes for the kidney patients. In Croatian, our campaign was named Za zdravlje bubrega, or for the health of the kidneys, until the 2030, from 2020 to 2030. You can see the visual of our campaign. It's 5 to 12. We don't have time, and the situation is not, I would say, quite optimistic. So this was the motivation that throughout the World Kidney Day, we actually try to disseminate the AAKP initiative, the Decade of the Kidney, and also the activities of the European Kidney Health Alliance that really made a huge contribution for the European ecosystem. We gathered so many respectful partners, you will see on the next slides, but we wanted really to strengthen finally the policy dialogue between all the stakeholders. It was necessary to bring the European Commission perspective, parliamentary perspective from the MAPs and the specialized group for the kidney health. We engaged Croatian representative office by the Commission, our local Croatian members of the European Parliament. We engaged the Ministry of Health, Croatian Public Health Institute, sick fund or insurance fund, who is actually in charge for the reimbursement of procedures, diagnostics, new innovative treatment. So it was quite important to have the payers' perspective, governmental perspective, administration perspective. In this dialogue, we included professional societies, all professional societies related for the, I would say, treatment or care of kidney patients. And we included even general practitioners, which are very important, timely diagnostics, pharmacists, umbrella patient organization, and of course the health media. So as I mentioned, we really wanted to bring the European spirit here, because Croatia, as the youngest EU member state, really, I would say, pushes forward in a tempo that the European Commission and the Parliament throughout health policies are actually pushing or promoting. And the Union is definitely taking care about kidney health throughout some initiatives such as Healthier Together. This is a completely new initiative, several months old, dedicated to the NCDs. EU for Health also program, especially in post-pandemic period, and the EU Beating Cancer Plan, which is a political priority, but many of risk factors are actually related for the kidney patients. You can see that first we prepared the field with the dialogue, with the policy dialogue with different stakeholders, where we included all the above mentioned or previously mentioned partners from the Commission, from the Ministry of Health, Sick Fund, from the healthcare industry, which is quite important. Most of the time, the industry is not a part of policy dialogues here because of some kind of stigma. And this is, I would say, one of the missions of a think tank, to include all the perspectives, all the stakeholders, because only by joint forces we can make a sure progress. After several virtual events, on the next slide, also you can see that we also included the president of the European Kidney Health Alliance, Professor Raymond Van Holder, which we are very thankful for his contribution. Definitely, we continued to be engaged as a think tank in activities done by the professional societies. This is an example of virtual forum with the rare diseases in nephrology, where we shared actually our story, how we communicate about some issues or topics related to kidney disease, where we also presented the Decade of Kidney as an amazing policy example by the AAKP. You can see that then we made an interviews with all the stakeholders. We wanted to hear their voice, hear their say. We prepared over 10 interviews with the representatives of the professional societies. On the next slide, you can also see how we managed to include actually them. So we engaged them in special editorials on our think tank platforms, including 3 professional societies. These are all the presidents from Hypertension Society, Society for Nephrology, Society for Kidney. On the next slide, you can see definitely that we included general practitioners who even presented the app for timely detection of symptoms or early signs, which are quite hard actually to recognize, of the chronic kidney disease. We included the perspective of clinical pharmacists, nephrologists. They all of them gave a video and written interview for our think tank platform as a part of overall campaign. On the next slide, you can also see that we included international associations. Our member of the European Parliament, Carlo Ressler, who is actually a member of MAP group on kidney health. So he gave high-level European perspective. And also we had a strong engagement, strong voice of the National Public Health Institute. On the next slide, you can see that they recorded video statements. How is the future of kidney health according to them, according to their institutions, and how can they see in the future, in next 10 years from 2020 to 2030, this policy change, policy shaping toward the decade of kidney for improvement of kidney patients. You can see that we also developed a strong follow-up. We wanted to prepare the recommendation for the whole ecosystem. So we prepared the white paper with referral to the all possible amazing policies related to the kidney health, chronic kidney disease. So on the next slide, you can see that we gave a background from the Economist Impact Report, which amazingly mapped, I would say, the recommendation for the chronic kidney disease after the background of chronic kidney disease and the need for political prioritization. On the next slide, you can see that we actually gave a statement from Commissioner for Health, Stella Kyriakides, and also the recommendations of the MAP group for kidney health, Hilde Woutman, because this was a very clear and short call to action from the Commission, from the Parliament, and this is, I would say, more than simple statement for our healthcare administration. After that, in our white paper, on the next slide, you can see that we actually gave and translated and, I would say, prepared the policy recommendation after overall global horizon scanning with 3 strong recommendations about the empowerment of education, disease awareness, then second level early detection and treatment, and look into the future, which we as a think tank want to promote, acquiring of digital tools for collecting data, for, I would say, saving data and communication. On the next slide, definitely was quite simply stated call for action towards the sick fund, Ministry of Health, Parliament, professional society, and patients related actually to political prioritization of chronic kidney disease, the need for faster access to innovation due to the huge disparities among West and Eastern European Union, and definitely the importance of timely and proactive screening according to the latest innovations in diagnostics. So this was a white paper. At the end, it was submitted to the sick fund to send to all the stakeholders, and then we went in, I would say, external space to promote the conclusions towards the media. You can actually see that we gathered all the stakeholders, the whole ecosystem for kidney health, and we organized the policy branch. Also, we invited the press representatives. So you can see in next two slides, just short, how it really looked like live. So on the next slide, you can see that we really invited all the stakeholders, all the contributors. You can see so many press clippings. It was, I would say, amazingly covered. We really push in every way that we politically prioritize the issue and to promote the potential of the decade of the kidney as AAKP story in this region, actually in Croatia. So we really had amazing coverage. On the next slide, you can see that we covered most of the media in print, radio, TV. We had a live introduction in our Good Morning Croatia TV show. We had follow-up throughout many shows with the professional societies, with scientific leaders. So it is something that is really valuable to give the attention, not only from the public policy perspective, but also from the lay public. Throughout the whole campaign, the decade of the kidney was our, I would say, leitmotif. This was our guidance and inspiration that we start to talk differently in Croatia about the chronic kidney disease. It was a platform over which we managed to connect the Europe, the professional societies, the patients, but it really gave us the wings that we look into the future of kidney patients in really strong and determined way. So really this platform gave us an inspiration that we make a strong and bold steps in a creative way. So at the end of the day, there is a quote I like to actually put always at the end, that I always wondered why somebody didn't do something about it, but then I realized that I was somebody, and the motivation that came out of our research from Health Hub, where we found the decade of the kidney, was something that really empowered us, that we speak about the decade of the kidney, and after all, to present you the Croatian story about hopefully success, because we will wait to see the impact of our steps in the months to come. Thank you, Ed, for the attention, and I'm open for your questions throughout email or however you want to approach to us for additional, I would say, information. Health Hub is always here for partnerships. Thank you.
Thank you, Ms. Galić. We are thrilled we are able to expand AAKP's Decade of the Kidney initiative to so many partners who are spearheading efforts in their respective countries, including Europe, Africa, South America, and across the Pacific.